For those of you who I haven't met, my name is Allison Warren, and I'm the multimedia PR specialist here at Sarasota Memorial Hospital. We're excited that Dr. Manuel Gordillo is with us today to give us an update about COVID-19 in our area and in the state as well. So I'm going to let Dr. Gordillo take it from here.
Hello, everybody. I'm Manny Gordillo, the hospital epidemiologist, and happy to be with you guys and ready to answer any questions.
Oh, okay. So we'll go ahead and open it up to Bob Mudge first. Okay.
Thanks, Allison. Dr. Gordillo, first of all, my impression and that of a lot of people that I've talked to is that there seems to be a general feeling among the public that because so much of the economy has quote unquote reopened, coronavirus isn't as big a deal as it was before. So what would you say to folks who are out and they're not worrying about social distancing, they're not wearing masks, to try to bring them around to taking those precautions?
Well, it's a misunderstanding that the virus is not a big deal. It is a huge deal. The virus has not changed, has not mutated for the better or for the worse. So the virus is out there lurking, waiting for opportunities to pounce. So as we open, that is going to be a critical time, because the reason that we have accomplished what we are accomplished now, which is a very low prevalence, a low incidence in that community, is largely due to all the work and all the good things that we have done in the past 2 to 3 months with social distancing, excellent hand hygiene, and all the precautions that we have taken. So now when we're going to open up, this is going to be a critical time, and we cannot let our guard down. You know, if we do, obviously there is no good biological reason why the virus will not come back. Will it come back the same ferocity that it did before, let's say in New York, or not? It's your guess is as good as mine. What's happening now probably is a little different than the first time around. What we're seeing is mostly outbreaks mostly in rural areas, but only time will tell what will happen in the next few weeks or months.
Second, to what would you attribute the fact that the number of cases statewide has been higher over the last week or so than it had been for several previous weeks? Is it in fact that so many more people are being tested, or are we seeing something of a return of the virus?
It's hard to say. You know, I think there is more testing, and there is no question about it. But if you look at the positivity rate, it is staying steady at about 3%, 4%. So in part, some of that can be attributed to increased testing. But it's even that the increased testing is a little difficult to gauge, because the testing sometimes is an accumulation of several days. There are certain laboratories that take several days to get the report back. So even that is a little difficult to tell in a short period of time. I think we need more time to see what the trend is. I'm encouraged by the fact that the positivity rate in general seems to be steady at about 3 to 4%. So that maybe tells me that it has to do with the vagaries of day-to-day testing, number of tests.
Is there enough testing being done now, or should that be ramped up considerably more?
Ramped up, you know, and I think that we're doing better. We're not where we want to be. There's still, if somebody wants to be tested, there's still some barriers on getting tested. You need to have a car, you need to have access to the place. Not everybody has that. So I think we're improving. The health department here locally has mobile units that goes from place to place, which is an improvement. There are a few more places popping up where they can do tests, where we still have some difficulties. For example, in pediatrics, it's a little more difficult to get a child tested if there are symptoms. There are not many, at least there were not that many places that were doing tests for children not too long ago. I think the situation is also improving, but I think we're not yet where we like to be, where it would be, I have symptoms, or I've been exposed, or I have concerns, I want to go to have a test done today. Can it be done and get the results in a timely fashion? We're not there yet. Yes, there's more than a lot more tests than we had a month ago, but still it's not, the accessibility is not where we want it to be. And also the turnaround time, many times it's not where it should be. Turnaround time is still way too long.
All right, thank you, Dr. Gordillo, and thank you, Bob. Next, we're gonna go to someone whose username is B. Pellerin. I believe they just joined the call if they have any questions for Dr. Gordillo. Nope. Okay, we're going to move on to Corey Clark.
I'm just here with Haley Hines from Fox 13.
Oh, okay, great. Then I will move down the list by alphabetical order. Oh, it keeps jumping out of order. We're going to go to Daniela.
Hi, guys, and hi, Dr. Gordillo. I just have a question about transmission. I know there's been a lot of conversation this week about asymptomatic transmission from the World Health Organization, making statements yesterday about the very rare, making statements today kind of going back on that and saying we didn't mean globally. Can you just tell us a little bit about, I mean, I don't know how much you can elaborate on this, but when it comes to transmissions, both with symptomatic patients and asymptomatic patients?
Yes, I'm familiar with the World Health Organization guidelines that were put in yesterday. There's a lot of discussion about that. And there's been discussion even from the beginning of the pandemic about what is the role of asymptomatic patients. So one thing is clear, and this is sometimes the unfortunate part is that we engage in these academic discussions, but we also, our responsibility is to educate the public and make it clear to the public, which sometimes there's a conflict in there between scientific part and how do we explain this to the public. So there's a concept of asymptomatic cases. They do exist. There's actually, depending on the populations, they could be as high as 80%, for example, in populations have been tested in pregnant women in New York, for example, when they turn for labor. 80% of them are asymptomatic. Why? We don't know. Maybe it has to do with pregnancy. In other places, like in ships, they found 50% of the people were asymptomatic. In other places where they tested communities, they're more like 30, 40%. So it depends where you testing, how you testing. You can find a substantial portion of them being asymptomatic. But the asymptomatic people, the people who have no symptoms, at some point, they start having symptoms. And those few days before the onset of symptoms, we call them pre-symptomatic, right before symptoms. So that's been clearly shown that folks that before symptoms, like 2 or 3 days before symptoms, they can be highly contagious, just as contagious as during the time of the onset of symptoms or the next 3 to 5 days, which is a very contagious period. So around the time of onset of symptoms, about 3 days before, 4 or 5 days after, that's when you are most contagious. The question becomes, well, what about before the 3 days, or about 4 days, 5 days, 5, 6 days before the symptoms? Are you contagious? And there are reports in the scientific medical literature that yes, that can happen, but we don't know is how often that happens. And that's where it becomes difficult because number one, it's a new pandemic. Number two, studies of that nature are difficult to do and they take time and you need to find the correct setting to do that. So what the WHO did was study what we have as evidence now, what has been proven. And the evidence so far indicates that it's probably not very common. You know, now how common or uncommon it is, it's impossible to tell because we only have done small studies looking at groups of 50 people, a cohort of 40 in China, 30 in Singapore, in a ship, another 50. So it's hard to make a conclusion specifically how significant that is. So in the opinion of the scientists at the WHO, which are very good scientists, they think that it's not a major driver of transmission. But we do know that it does happen. So that's where it is now. Now, some people disagree with that because they put more value on those small studies and they say, well, the small studies do show that there is transmission at the asymptomatic period. Another discussion is, well, who is asymptomatic? You know, is somebody that has a mild fatigue and malaise, is that asymptomatic or is this a mild symptom? So, you know, there's some semantics and how do you define this? The bottom line is a controversial issue. It probably happens. We don't know just how often it happens.
Gotcha. That was my question. Bob asked the other questions I was interested in. Thank you.
Thank you.
All right, next I'm going to unmute Haley.
Okay, hello everybody. Hello, doctor. Thank you for talking to us this afternoon. You know, when we see these numbers going up, increasing or kind of staying around a higher amount of new positive cases every day, of course, that could be cause for alarm for some, but you know, you take into factors the percent positivity, the hospitalizations, the amount of people getting tested. Do you have any, I guess, words of advice or thoughts that you would like people to keep in mind as we're seeing these new numbers of positive cases coming out day after day?
Well, yes, again, the message is the same. You know, we should be extremely satisfied, happy that the numbers in many populations, in many communities are fairly low. Sarasota is among them. You know, the incidence in Sarasota nowadays is fairly low. Now, why is it? Did we get lucky? I think in part we got lucky, but I think we also need to recognize that the public here did a very good job at social distancing in general, wearing the mask when they need it, washing their hands, keeping the elderly protected. Same thing in the nursing homes, the hospitals, all the employers, the schools. Everybody did their job. Now, obviously we cannot keep this at that level forever. We need to start opening back up. But as we do that, that's when we need to be the most vigilant and most careful. One of the things that we need is a good sentinel and detection system. We need more testing, and all our sentinel our sentinel methods that we have in the community out there need to be at 100% operation. So what is that we have? Well, we have our health department that do detection, contact tracing. They look at communities where there may be an increase in incidence in cases. So far, over here in Sarasota, we haven't had major clusters. There were a few weeks ago clusters in skilled nursing facilities. Those were dealt with, and what we're seeing now is low-level transmission. Our percent positivity rate, as I said, it's been fairly low now for several weeks, and we hope to keep it that way. Now, I think when Bob asked me earlier, I said, we're going to have problems somewhere, and those problems in other communities can affect us. For instance, me working in the hospital, I can start seeing what happens in the community relatively early. Me working in the hospital and doing the work that I do still see transmission. Every day I hear somebody getting the disease somewhere, and we need to investigate who are the contacts. So for the vast majority of people out there, they will not see that. But since I'm an epidemiologist, I practice infectious diseases, I do see those cases. And right now, we're seeing sporadic transmission, and we hope that it stays sporadic. The virus is there, it's lurking, and it's waiting for opportunities. Right now, in our general area, I think Sarasota County is doing the best. Manatee County, just north of us, they probably have more cases than we do. And how do we know this? Because we normalize the incidence of the cases by population. So how many cases by 100,000 people do we have? Well, we have about a third what they are finding in Manatee. But more importantly, we probably have a seventh of what they are finding, for example, in DeSoto County. And we're all interconnected. So what's happening in DeSoto County can affect us. And in fact, we are referral centers for DeSoto County. So their patients, when they get sick in our hospital. So we have to be also very, very aware of those issues, that what happens elsewhere can affect us. And this is exactly what happened in February. People coming from other places, from New York, came here bringing virus, and that resulted in larger outbreaks.
And now that we are in phase 2 of the governor's reopening plan, more businesses are reopening, people are getting comfortable or just getting cabin fever, but are there still some activities or locations or things that you would still advise people against doing, or at least to use extra caution?
Well, yes, there's a huge difference between some activities and the locations. I think the things that everybody is now aware is that the outdoors, there's a much lesser risk than indoors. Prolonged exposures are of much higher risk than short exposures. And the more people that are congregated in an area, and especially if they cannot maintain the distance, that is a higher risk. And certainly we talked about asymptomatic and especially pre-symptomatic issues are important. So the only thing that we have to prevent pre-symptomatic transmission is masks. So there's a big discussion out there among the public about mask use versus no mask use, etc. I gotta tell you that if you're pre-symptomatic and you're at close range indoors, you're putting a lot of people at risk. So I think I beg you that if you're in that position, please wear your mask. We're doing a favor to everybody else around you.
Okay, thank you very much, Doctor.
All right, next up, we're gonna go to Samantha Sonner.
Hello, Dr. Gordillo. Good to see you. Dr. Gordillo, when we first started talking about this back in March, we talked a lot about the worst case scenarios that we could see with this. How do you think, as we are coming out, the hospital is emptying out, how do you think we made out here as a community?
Well, we obviously had more cases than we wanted to have. There were a number of deaths in the hospital. It's very unfortunate. At some point, we were under a lot of stress, and getting all these very extremely ill people coming to our hospital and having them for extended periods of times in the ICU. That is something that we have never seen in our lifetimes. So yeah, this disease is something that all of us that we've been practicing infectious diseases in intensive care, hospital medicine, we have not seen this before. So at that time, at certain time was very stressful and very scary. And we were hoping that the community will help us with what they did. They did wonderful work by following the advice from the CDC and from the Florida Department of Health, from the county, and from all of us physicians. You did a wonderful job, and this has resulted in a decrease in the cases, which is where we would like to keep it for as long as we can.
You know, and as we start to reopen, you know, I know you talked a lot about looking at those percentage rates and looking at those daily number of cases. Right now, Sarasota County has a pretty static, low number of cases. What change would you be looking for, you know, mostly that would be a sign of a resurgence of this disease?
Well, obviously that's one number that is relatively easy to track, you know, the percentage of cases. It's relatively easy, but you know, we would like somebody ask, are we doing enough testing? And I would like to say, yes, we would like to do more testing than we are doing. And we would like to have that testing also turning around faster than it is. You know, we get a test and we get it the next day. It's one thing, then we get it 7 days later. So once we have that system in place, then we can also allow our health department to do the appropriate contact tracing, which is the most successful strategies that have been used in countries where they've been able to control this and keep it under control. I'm talking, you know, the strategies used in South Korea, Singapore, New Zealand, Iceland, where they do a lot of active testing and contact tracing, and then quarantining the people that they needed to quarantine, rather than what we had to do, which is basically quarantine everybody. And we were not doing enough testing and not enough contact tracing. So I don't think that's a strategy that that we should engage again. You know, I think we have learned what the correct solution is, and that's what we should do, rather than locking down the entire population. We just need to identify the individuals that need to be quarantined and individually locked down, rather than locking the entire society.
All right, great. Thank you so much.
You're welcome.
So, Dr. Gordillo, before we end this call, was there anything else you wanted to add, or anything you think we didn't cover today?
No, I think that we've said it before. This is a very important time. You know, we need to move forward with opening the society, but we have to do it carefully and smartly. If we start engaging in behaviors that will allow the virus to resurge, we're going to get into that. And the virus, unfortunately, is very transmissible. The transmissibility depends on us. You know, again, there is this concept about the R naught. You know, depends on what we do. The virus is going to do the same. You know, if we allow them to do that, the transmissibility can go from, let's say, whatever it is now, around 1. So at a transmissibility of 1, we're not going to get a lot of growth in surges. But if this transmissibility increases to 1.5, one case will create 1.5 cases. If it increases to a 2, one case will result in 2 cases. And that's when we get into exponential growth, and we get into trouble like we did back in March again. And this is what we need to avoid. But it's all depending on how we behave, how smart we approach this reopening.
All right, Dr. Gordillo, thank you once again for joining us, and thank you to the members of the media who participated. And we want you all to stay home, stay safe, stay informed, and we appreciate you being here. Have a great rest of the day.
Thank you for having me.